Anatomy DAHAR series. Blood supply of the heart. Basic module 2021 diagram-based program. Illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. Introduction. The heart. In Latin cor, in Greek cardia. Heart is a component of closed-circuit cardiovascular system, that is, the system consists of heart and blood vessels. It is made up of specialized type of conducting and self-contracting muscles. It is a dual suction and pressure pump which works continuously by rhythmic dilatation and contraction around the clock through joy or sorrow from womb, that is third week of intrauterine life, to before reaching the tomb. It beats about 100,000 times per day, pumping over 1.5 million gallons of blood per year, equivalent to the amount of water in Olympic-sized swimming pool. Most of the functions of the cardiovascular system ultimately depend on the heart. Despite impressive workload, the heart is a small hollow muscular organ the size of one clenched fist. Therefore, the heart, a muscular organ, needs energy and requires most reliable supply of oxygenated and nutritious blood consistently without fail, especially during maximum exertion. Furthermore, oxygen consumption of the myocardium, muscles of the heart, is much more than that of other types of muscle in the body. History. In fact, the earliest report on the nourishment to the heart was made by 13th century physician Ibn an-Nafis, who described the role of the blood vessels on the wall of the heart in nourishing the heart. Saladin. The additional blood supply can be achieved by an arterial system made up of vasa vasorum, the vessels supplying to the thick wall of the blood vessels. The heart, which is part of the vascular system, is thus supplied by big vasa vasorum called coronary arteries, which lie over the wall of the heart. Why are they called coronary arteries? The name coronary arteries derives from the Latin coronarius, means encircling in the manner of crown. The coronary arteries encircle the heart along the atrioventricular groove, the groove or sulcus around the heart between two atria above and two ventricles below. Normally, human heart is supplied by two coronary arteries, right and left. They arise from the root of the ascending aorta, immediately outside the aortic opening of the heart. Therefore, the coronary arteries are the very first branches which carry the richest oxygenated blood for the heart itself. The first and the best for self. From where the coronary arteries arise. Two coronary arteries arise from the aortic sinuses just above the aortic opening. This is arch of aorta, this is ascending aorta, these three bulges are aortic sinuses. This is aortic opening with three cups or leaflets. This is anterior cups, this is right posterior cups, and this is left posterior cups. What is sinus? Aortic and pulmonary sinuses. Immediately superior to the aortic and pulmonary openings, the ascending aorta and the initial part of the pulmonary trunk each possesses three small outward dilatations, bulges, called aortic and pulmonary sinuses respectively. Each sinus is opposite to the respective semilunar cusp leaflet of aortic and pulmonary valves. Similar to the cups, therefore, aortic sinuses in adult possesses one aortic sinus anterior labeled A and two posterior aortic sinuses right posterior labeled RP and left posterior labeled LP. In this slides, we have two diagrams, diagram A and diagram B. In diagram A, we are showing pulmonary opening, which is in front and slightly to the left, and this is aortic opening, which is behind and slightly to the right. Pulmonary opening has three sinuses, one posterior and two anterior, right anterior and left anterior sinuses. In aortic opening also has three sinuses, one anterior and two posterior sinuses. This is left posterior sinus and this is right posterior sinus. This is aortic opening. It consists of three sinuses. This is anterior aortic sinus and this is left posterior aortic sinus and right posterior aortic sinus. Anterior aortic sinus gives right coronary artery and this sinus is also called right coronary sinus. Left posterior aortic sinus gives left coronary trunk. Because of that, left posterior aortic sinus is also called left coronary sinus. However, right posterior aortic sinus doesn't give any artery and it is called non-coronary sinus. The coronary arteries, which are filled with blood during ventricular diastole, not like other arteries in the body. External surfaces of the heart. Grooves, sulci. This is anterior view of the heart and this is posterior view of the heart. What are the grooves, sulci of the heart? Singular is sulcus, plural is sulci. The heart is divided by internal partitions into four chambers, two atria, that is right and left atria, and two ventricles, that is right and left ventricles. Lines of attachments of the partition to the wall of the heart produce the grooves, sulci on the external surface of the heart. They demarcate the chambers. This is atrioventricular grooves, that mean the groove between the atrium and the ventricle, This is interventricular grooves, that is the grooves between the two ventricles. The groove that demarcates two atria from the ventricle is atrioventricular groove, sulcus. It has anterior and posterior segments. This is atrioventricular groove between the atria and ventricle. This is anterior atrioventricular groove and this is posterior atrioventricular groove. The grooves that demarcate the two ventricles are interventricular grooves. This is two ventricles, which is demarcated by interventricular grooves. This is anterior interventricular grooves, and this is posterior interventricular groove. What is the crus? It is a crossing of posterior atrioventricular groove and posterior interventricular groove on the inferior, that is diaphragmatic aspect of the heart. This is the one crus, where it is crossing of posterior atrioventricular groove crosses the posterior interventricular groove. This is the little crossing is called the crus at the posterior surface, that is diaphragmatic surface of the heart. This diagram is the histological aspect of layers of the wall of the heart in three-dimension view. The layers of the wall of the heart are arranged from superficial to deep. The outermost layer, this is the one, is pericardium. Peri means around, cardium means heart. This is the layer which is around the heart. This is made up of fibrous tissue and thus known as fibrous pericardium. Deep to the fibrous pericardium is a very thin layer of membrane made up of simple squamous epithelium called serous pericardium. Far deep inside, we have very thick muscles of the heart called myocardium. This myocardium is again covered by another thin layer of membrane made up of simple squamous epithelium and called serous pericardium. Now between the two serous pericardium, we have a space called pericardium cavity. The pericardium, you can see here, outside the pericardium cavity, that is the serous pericardium outside, is called parietal layer of serous pericardium. Deep to the pericardial cavity, this serous pericardium is called visceral layer of serous pericardium. So this is parietal layer of serous pericardium. This is visceral layer of serous pericardium, which covers the myocardium. Myocardium is the thickest layer, especially in the ventricles of the heart. The deepest layer among all these layers are called endocardium layer, which is directly exposed to the blood in the chambers of the heart. Just deep to the endocardium is the deepest layer of the myocardium and called subendocardial layer. Again, this is we know that serous pericardium visceral layer, which is also known as epicardium. Deep to this epicardium is again outermost part of the myocardium. This is called subepicardial layer. So all the layers are from superficial to the deep is fibrous pericardium. Deep to it is parietal layer of serous pericardium, and deep here is visceral layer of serous pericardium. Between the two is pericardial cavity. Deep to the visceral layer of serous pericardium, which is epicardium, deep to it is called subepicardial layer, which is the outermost part of the myocardium. Now you come deep here, this is endocardium. Just deep to the endocardium is subendocardial layer, which is the deepest part of the myocardium. blood supply of the wall of the heart. Let's go revision. This is fibrous pericardium. This is parietal layer of serous pericardium. This is visceral layer of serous pericardium, also known as epicardium. This is the myocardial layer. Outermost part of the myocardium is deep to the epicardium, thus called subepicardial layer. This is the innermost layer, endocardium. Just deep to the endocardium is subendocardial layer, that is deepest part of the myocardium. Coronary artery and its branches are in the subepicardial layer, that is the outermost part of the myocardium. These coronary arteries and branches will supply the blood to the epicardium and almost entire thickness of the myocardium. Another set is by diffusion of blood coming from the chamber of the heart, coming through the endocardial layer and reach to the subendocardial layer. Only these two parts is supplied by direct blood from the chamber by diffusion and microcirculation. So this is the subendocardial layer, is the layer which is farthest away from the coronary blood supply and farthest away from the blood supply coming from the chamber of the heart. Therefore, when there is lack of blood supply, this layer, subendocardial layer, is the first to be affected and occurs ischemia in this layer. Coronary arteries. Human heart is normally supplied by two coronary arteries, right and left. Now we are going to present these coronary arteries according to the following subtopic. Origin, cause of the main trunk, main branches and smaller branches, area and structures supplied by each coronary arteries, and applied anatomy. Right coronary artery. Look at the diagram. This is the diagram of the heart seen from above. This is in front, this is posterior, this is left, and this is right. We can see two big vessels here, pulmonary trunk and aortic opening is here. Each opening is guarded by three valves with three sinuses are there. Aortic opening, as you see here, we have three sinuses, one anterior and two posterior. This is right posterior and this is left posterior. This is right auricular appendages above the right atrium. This is left auricular appendages over the left atrium. This is tricuspid valve, that is also called right atrioventricular opening, and this is mitral valve, that is also called left atrioventricular opening. Now, origin of the right coronary artery. As we have mentioned here, this is aortic sinuses, this is anterior aortic sinus, this is left posterior aortic sinus. Right coronary artery arises from the anterior aortic sinus here at the beginning of the ascending aorta just after the aortic valve. So right coronary arteries arises from the anterior aortic sinus. The cause of the right coronary artery. The main trunk of the right coronary artery has two segments or two parts. The first segment, the first part, starts from the origin, that is from the anterior aortic sinus, passes forwards between the pulmonary trunk on its left and right auricular appendage on its right, so that the first part of the right coronary artery is between the pulmonary trunk and the right auricular appendages. Look at the diagram. This is anterior view of the heart. This is ascending aorta. This is arch of aorta. At the beginning of the ascending aorta, we have aortic sinuses. This one is anterior aortic sinus. This is right atrium and its appendage. This is right ventricle. This groove or sulcus is right anterior atrioventricular sulcus. The one behind is posterior atrioventricular sulcus or groove, and this is the crust where posterior, that is inferior atrioventricular sulcus, is crossed by interventricular sulcus. Posterior interventricular sulcus is the one crossed. The crust is here. Now we are going to talk about the right coronary artery. Right coronary arteries arises from the anterior aortic sinus and comes out along the right anterior atrioventricular groove. The artery comes down almost vertically and reaches to the right inferior border of the heart. This is the first segment of the right coronary artery. The second segment is the right coronary arteries winds around and reach to the posterior atrioventricular sulcus, goes forwards here to the left, and in majority of the cases, that is over 60% of the cases, this right coronary artery will terminate little bit left of the crust. You can see here, normally, that is in about 60%, right coronary artery will end little bit beyond, that is left of the crust. In this diagram, we are showing the heart's anterior view. This is right inferior border of the heart. This is where the crust is located at the back of the heart. This is left border of the heart. Length of the second segment of the right coronary artery varies. Normally, that is in about 60%, it terminates just beyond the crust, that is just left to the crust. However, it may terminate in A. Right coronary artery will terminate at the right inferior border of the heart, where it turns around in 10%. B. Right coronary artery will terminate between the right inferior border of the heart and the crust in 10%. Between the right inferior border of the heart and the crust is another 10%. And C at the left border of the heart, that is in 20%. That is, in this case, the right coronary artery will run until to the left border of the heart. Branches of the right coronary artery. For descriptive purpose, branches of the right coronary artery are divided into two groups. First group, A, branches from the first segment of the right coronary artery supplying the anterior surface of the heart, and B, branches from the second segment of the right coronary artery, supplying to the inferior, that is the diaphragmatic surface of the heart. First group, branches from the first segment, that is in the anterior surface of the heart, are the first one is anterior right atrial artery, second is sinoatrial SA nodal branch, third is right conus branch, fourth is anterior ventricular branches, and fifth one is right marginal branches. This sinoatrial nodal branch may comes from anterior right atrial artery. Second group is branches from the second segment, that is inferior, that is diaphragmatic surface of the heart. First is posterior atrial branches, second is posterior ventricular branches, and third is posterior interventricular, that is right posterior descending RPD branch in 85%. This is the anterior view of the heart. This is right atrioventricular sulcus or groove, along which is first segment of the right coronary artery descend down to the right inferior margin of the heart. We are going to talk about branches from the first segment of the right coronary artery. The very first one is anterior right atrial artery, A1. A1, this is the anterior right atrial artery. 2 is sinoatrial SA nodal branch. This is SA nodal branch. It may arise from the main right coronary artery or may come from the anterior right atrial artery. This SA nodal branch, it will supply the SA node here. The third one is right conus branch. This is the right conus branch going to the infundibulum here, lower part of infundibulum. The fourth one is anterior ventricular branches. These are the one, anterior ventricular branches to the anterior surface of the right ventricle. And number 5 is right marginal branch, which may reach up to the apex. This is the posterior view of the heart. This is left atrium. This is left ventricle. This is right atrium, and this is right ventricle. This is posterior atrioventricular groove, and here will be the crus. Okay, then what are the branches from the second segment of the right coronary artery? Before we talk about the branches, let's see, this is actually right coronary artery on anterior surface of the heart, coming down to the right inferior border of the heart, turn around and go along the posterior atrioventricular groove, and this artery will go across the crus, and just after the crus it will terminate. And what are the branches given by this second segment, that is the posterior part of the right coronary artery? Very first one is posterior atrial branch, that is supplying to the back of the atrium. Second one is posterior ventricular branches, supplying to the back of the right ventricle. The third one is posterior interventricular branch, which is the biggest one, also called right posterior descending RPD, along the posterior interventricular groove. And you may have coming from here, that is from the second segment of the right coronary artery, supplying to the atrioventricular node, This AV nodal branch is coming from the second segment of the right coronary artery. Sinuatrial SA node, atrioventricular AV node, and atrioventricular AV bundle. They are specialized type of cardiac muscle and not nerve tissue. Let's see the diagram first. This is superior vena cava. Opening of the superior vena cava is here. Here will be, inside will be the crest here. We call cresta terminalis. That is inside in the right atrium. But outside the cresta terminalis is sulcus terminalis is there. This will be the upper part of the sulcus terminalis. This is the right atrium showing the interatrial septum. Now we are going to talk about sinuatrial node, SA node. Where is the sinuatrial node? I hope you remember when we talk about the layers of the heart wall, we know that visceral layer of pericardium, serous pericardium, is also known as epicardium. It covers the myocardium. So just deep to the epicardial layer is subepicardial layer. Okay, now when we are going to talk about this one, sinuatrial node, it is situated in the subepicardial layer of the anterolateral wall of the right atrium, just below the opening of the superior vena cava and at the top of sulcus terminalis. Atrioventricular AV node, where is that one? It is situated in the interatrial septum of the right atrium. This is the interatrial septum of the right atrium. AV node is situated here. The arterial supply of the SA node, AV node, and AV bundle derived mostly or commonly from the right coronary artery. Structures of the heart supplied by right coronary artery. This is the diagram showing cross sections of two atria, right atrium and left atrium. This is interatrial septum. And cross section of the two ventricles. This is right ventricle and this is left ventricle. This is interventricular septum. This is SA node and this is AV node related to the right atrium. This is right coronary artery going around the atrioventricular groove. Now, what are the structures of the heart supplied by right coronary artery? Very firstly, entire right atrium. This is the one, entire right atrium. Almost entire right ventricle. Almost entire right ventricle, which includes inferior 1/3 of the interventricular septum. A strip on the inferior surface of the left ventricle, but this right coronary artery does not supply upper 2/3 of the interventricular septum and anterior surface of the right ventricle, little strip next to the anterior interventricular groove. This little part and this little parts are not supplied by the right coronary artery. They are supplied by left anterior descending from the left coronary artery. Next is sinuatrial node, SA node, supplied by right coronary artery in 65%. Atrioventricular AV node in 80 to 90%. Atrioventricular bundle will be continuation here. That will be right half, and then right bundle branch This is the right bundle branch, which is supplied by the right coronary artery, and then this is right ventricular papillary muscles. All are supplied by the right coronary artery. Left coronary artery. In this slide, we are showing the heart looking from above. That means superior view of the heart. This is anterior, this is posterior, this is right side, and this is left side. We can see two big openings here. That is pulmonary trunk, which is in front and slightly to the left. This is aortic opening, which is behind and slightly to the right. Each opening is guarded by 3 valves. Above each valve is sinus. In aortic opening, 1 anterior aortic sinus and 2 posterior aortic sinuses. This is right posterior and this is left posterior. We can see another 2 big openings here. This is tricuspid opening, also called right atrioventricular opening, and this is mitral opening, which is also called left atrioventricular opening. This is right auricular appendages, which lies on top of the right atrium. This is left auricular appendage, which is at the top of the left auricle. Now the origins of the left coronary artery. Left coronary artery arises from left posterior aortic sinus. The cause of the left coronary artery coming from the left aortic sinus runs forwards and slightly to the left, between pulmonary trunk in front and left auricular appendage behind. Left coronary trunk reaches to the anterior atrioventricular groove and divides into 2 main branches. One is left anterior interventricular artery, or also known as left anterior descending artery, and second one is the circumflex artery. So left coronary trunk will divide into 2, that is anterior interventricular artery, also known as LAD, left anterior descending artery, and the second one is the circumflex branch. Terminal branches of left coronary artery. This is the anterior view of the heart. You can see here, this is anterior interventricular groove. This is the apex of the heart. This is posterior interventricular groove. Now we are going to talk about the first main branch of the left coronary artery. That is the anterior interventricular artery, which is also called left anterior descending LAD artery. This artery descends along the anterior interventricular groove, coming down here. It passes around the apex of the heart, and ascends along the lower part of posterior interventricular groove. As you see here, this is the left coronary trunk, divides into anterior interventricular artery and circumflex artery. This is anterior interventricular artery coming down along the anterior interventricular groove, goes around the apex and go back to the lower part of the posterior interventricular groove. It anastomoses with right posterior interventricular artery. This is right posterior interventricular artery, which is also known as right posterior descending artery, coming from the right coronary artery. The second main branch of the left coronary artery is the circumflex branch. Here we can see the circumflex branch is here. This is the left coronary trunk, which divides into left anterior descending and the circumflex branch. The circumflex branch runs to the left along the anterior atrioventricular groove, and it reaches to the left border of the heart, where it turns backwards along the posterior atrioventricular groove. The circumflex artery is divided into two segments. The part which is anterior surface of the heart is the first segment. The part which is behind the heart, that is along the posterior atrioventricular groove, is the second part. Posterior segment of circumflex branch. Here we are showing two diagrams of the heart. This is the anterior view of the heart. This is the posterior view of the heart. This is the circumflex branch. When you look from in front, it is between the left atrium and left ventricle, that is anterior atrioventricular groove. It goes around to the left, turn around at the left border of the heart, and then goes backwards. Now if you look from behind, the same anterior segment of the circumflex, you can see here it is in the anterior part, and then after coming around the left border, it is in the posterior atrioventricular groove. Here, this is posterior segment. So this is anterior segment, this is the posterior segment. Where will this posterior segment nest the most? Commonly, we said that is in 60%. This is the right coronary artery coming around the right inferior border of the heart and coming around along the right posterior atrioventricular groove, and after crossing the crust, this too will nest the most. That is beyond the crust. In 60%, this too will nest the most. Branches of the left coronary artery. It gives two main branches, A. Left anterior descending LAD and B. Circumflex branches. A. Left anterior descending LAD artery gives 1. Interventricular septal branches, 2. ventricular branches, 3. atrioventricular AV node and atrioventricular AV bundle branches. B. Circumflex artery has two segments, anterior and posterior. The anterior segment gives 1. Sinuatrial nodal branch, 2. Anterior left atrial branches, 3. Anterior left ventricular branches, 4. Diagonal branch, and 5. Left marginal branch. Next is posterior segment of the circumflex gives posterior left atrial branch, posterior left ventricular branches, and atrioventricular AV nodal branch. Branches of the left coronary artery. In this diagram, here is the left coronary trunk, which divides into left anterior descending branch, which comes down along the anterior interventricular groove, and this is the circumflex branch, which goes to the left between the anterior atrioventricular groove. Now we are going to talk about the branches of the left anterior descending artery, A. First is 1. Interventricular septal branches. That means the branches coming from the LAD will supply the anterior 2/3 of the septum. 2. Ventricular branches. Branches coming out from the LAD supply the anterior surface of the right ventricle and anterior surface of the left ventricle. Third is atrioventricular node and atrioventricular bundle branches, which come from the first and second septal branches. They are coming from here. Here is AV node and AV bundle receive the blood supply from first and second septal branches coming from the LAD. The circumflex artery has two segments, anterior and posterior segments. Now we are going to talk about the branches coming from the anterior segment of the circumflex artery. They are number 1, sinoatrial nodal branch. This is the one, sinoatrial nodal branch coming from the circumflex artery. And number 2 is anterior left atrial branches, anterior left atrial branches. Number 3, anterior left ventricular branches, anterior left ventricular branches. Number 4, anterior left ventricular diagonal branches. And number 5 is left marginal branch. This is the posterior view of the heart, showing the posterior segment of the circumflex artery. This is the circumflex artery, which is on the anterior surface of the heart, which turns at the left border of the heart and continue at the posterior surface of the heart as the posterior segment of the circumflex artery. What are the branches coming out from the posterior segment of the circumflex artery? Very first one is posterior left atrial branch, which is supplying to the back of the left atrium. Number 2 is posterior left ventricular branch. This is the one, posterior left ventricular branch supplying the posterior surface of the left ventricle. And atrioventricular AV nodal branch. This is the one extended and supply the AV node. Structures of the heart supplied by left coronary artery. This is the cross-section of the two atria, right atrium and left atrium. Cross-section of the two ventricles, right ventricle and left ventricle. This is left coronary arteries, and this is branch of the left coronary artery. This is the LAD artery. From the main trunk of the left coronary artery extends to the left and goes around the heart is the circumflex artery. So the parts of the heart supplied by the left coronary arteries are lower part of the infundibulum and the upper part of the right ventricle, entire left atrium, almost entire surface of the left ventricle, almost entire surface of the left ventricle except a strip on the inferior surface. This is the one close to the posterior interventricular septum, this part, which is supplied by posterior interventricular artery coming from the right coronary artery. Next is left coronary artery will supply apical region of the heart formed by both ventricles. A strip on the anterior surface of the right ventricle, adjacent to the anterior interventricular groove. This is the part adjacent to the anterior interventricular groove. This little part, the strip of the anterior surface of the right ventricle. They all are supplied by the left coronary artery. Structures of the heart supplied by left coronary artery also includes, in addition to what I have said earlier, they are anterior 2/3 of the interventricular septum. This is interventricular septum. Anterior 2/3 of interventricular septum is supplied by LAD, left anterior descending branch of the left coronary artery. Sinoatrial node in 35%, AV node in 10 to 20%, left half of the AV bundle, left bundle branch LLB, anterolateral papillary muscles of both right and left ventricles, all are supplied by the LAD, left anterior descending branches. Dominant coronary artery. What does that mean? Dominant means controlling influence, major controlling. In this case, major coronary artery blood supply to the heart. The posterior interventricular artery is the key factor from which this artery arises, from which this posterior interventricular artery arises, from right coronary artery or from left coronary artery. In about 80% of the hearts, the posterior interventricular artery arises from the posterior segment of the right coronary artery. Then it is the right dominant. Look at this picture. Right coronary arteries in 60% extend here, go to the back and crosses the crust, and just beyond, that is left of the crust, and right coronary artery will end here. Before it terminates, it will give posterior interventricular artery. Again, in another 20% of the case, right coronary artery extends right up to the left margin of the heart. In this case also, posterior interventricular artery arises from the right coronary artery. So in these cases, the heart is supplied by right coronary artery dominant, which is the dominant one. That is in about 80% of the cases. Continuation of dominant coronary artery. In about 10% of the hearts, however, the posterior interventricular artery is a continuation of the circumflex artery. This is the circumflex artery coming right up to here. So posterior interventricular artery is coming from the circumflex of the left coronary artery, or maybe from LAD, left anterior descending artery, which is also a branch of the left coronary artery, coming from in front, comes around the apex and come back to here as the posterior interventricular artery. In this case, posterior interventricular arteries is the terminal branches of the left coronary artery, and in this 10%, left coronary artery is the dominant artery. However, in about 10 to 15% of the hearts, branches of both coronary arteries, that means from right and from the left arteries, comes along the posterior interventricular grooves, that is the balance pattern, and called co-dominant. That means posterior interventricular arteries, one part coming from the right coronary artery, another one coming from the left coronary artery. In this case, we call codominant. Knowledge of these variations is important in the interpretation of the coronary angiogram. Common sites of occlusions of the coronary artery. Let's see the diagram of the heart, which is the anterior view. This is the right coronary artery, first segment, and this is the second segment, which is at the back of the heart. This is the branch that is the posterior interventricular artery or right posterior descending artery. Another one is left coronary arteries. It gives anterior branch, that is the left anterior descending branch. And another one is circumflex branch, which will go backwards and anastomose with the right coronary artery. So about the occlusions, there are three most common sites of coronary artery occlusions, and the percentage of involving each artery are: very first one is anterior interventricular, that is left anterior descending LAD artery. This is very common, about 40 to 50%. That's why it is called widow maker, this artery is. Number two is right coronary artery. It may be occluded in anywhere in the first segment or in the second segment or in the right posterior descending branch, which is about 30 to 40%. And the third is circumflex artery, coming from here, left coronary artery. Circumflex artery is also common, but about 15 to 20%. So therefore, total occlusions of the branches of the left coronary artery is 55 to 70%. Coronary arteries are essentially functional end arteries. That is, when a coronary artery or its major branch is blocked suddenly, unable to develop a sufficient collateral channels in a short period, infarct and loss of function takes place at the area supplied by that branch or artery, often cause a sudden death. Therefore, time factor of occlusion is an utmost important for the survival in occlusion of the coronary arteries and their branches. The intercoronary arterial anastomosis were found in less than 10% of apparently normal hearts, but in 40% of anemic hearts and in 100% of hearts with old coronary occlusion. Clinical features of myocardial infarction, MI. Number 1, sensation of pressure, crushing, sinking and pain in the chest that lasts longer than 30 minutes. Nausea or vomiting, sweating, shortness of breath and tachycardia, increased heart rate. Chest pain radiates to the medial side of the left arm, forearm and hand. Sometimes it may be referred to the jaw or the neck. Slow or gradual blocking of the coronary arteries is less dangerous than sudden blockage. Narrowing of less than 70% rarely show collateralization. Referred pain. What is referred pain? Pain felt in the part other than that at which it was produced. That means pathology is at one site, it's pain at another site. The heart is insensitive to touch and pressure, cut and temperature, that is cold and heat. However, in ischemia, there is decrease in blood supply with oxygen deficiency. The metabolic products accumulate at the site of ischemia, which stimulate the pain nerve endings in the myocardium. The radiation of referred pain depends upon the site of myocardial infarction and nerve supply. As stated earlier, the obstruction in the left anterior descending LAD is 40 to 50%. The circumflex branch, which is also come from left coronary artery, is 15 to 20%. And right coronary artery is about 30 to 40%. That is total percentage of ischemia in the territory of the left coronary artery is about 55 to 70%, more common than that of right coronary obstructions. Referred pain continuation. In this diagram, this is the heart showing the ischemic area A. This is sympathetic fibers B. This is spinal cord segments C. And this is the referred pain area on the body D. The pain sensation from the ischemic area of the heart A is carried by sympathetic nerve fibers B to first thoracic to fourth thoracic segments of the spinal cord C. These spinal cord segments also received somatic general sensation from the first thoracic to fourth thoracic dermatomal area, especially from the left side of the body D. Therefore, pain of the myocardial ischemia is commonly radiated to those dermatomal areas. They are substernal, root of the neck, left pectoral region, left shoulder region, and medial aspect of the left upper limb. Venous drainage of the heart. This is the posterior view of the heart. This is left atrium. This is left ventricle. This is right atrium. This is right ventricle. This groove or sulcus is between the left atrium and left ventricle, that is posterior atrioventricular sulcus. Now we are going to say about venous drainage of the heart. The venous blood from the wall of the heart is drained mainly by 5 veins that empty into the coronary sinus and partly by 2 sets of veins. The coronary sinus. What is coronary sinus? The coronary sinus is a wide and short venous channel of about 2 to 3 cm long. It is located in the posterior part of the atrioventricular groove between the left atrium LA and left ventricle LV. This is the coronary sinus located between the posterior surface of the left atrium and left ventricle. The coronary sinus runs from left to right along the groove and drains into the right atrium. Coronary sinus runs from left to right and drains into the right atrium. Opening of the coronary sinus. Let's see the diagram first. This is the right atrium opened and seeing the inside of the right atrium. This is interatrial septum, that is the septum between the right atrium and left atrium. Here is the opening of the inferior vena cava. This is inferior vena cava. This is the opening of the coronary sinus. This is the tricuspid valve, that is right atrioventricular opening. Opening of the coronary sinus. Opening of the coronary sinus is on the interatrial septum of the right atrium. It is on the interatrial septum of the right atrium. It is slightly on the left and anterior to the inferior vena cava opening. This is slightly on the left and anterior to the inferior vena cava opening, and right and behind the lower part of the tricuspid valve. It is on the right and behind the lower part of the tricuspid valve. Coronary sinus receives about 60% of the venous blood from the walls of the heart. What are the tributaries of the coronary sinus? They are great cardiac vein, middle cardiac vein, small cardiac vein, posterior vein of left ventricle, and oblique vein of left atrium. Great cardiac veins. Let's see the diagram first. This is anterior view of the heart. This is the apex. This is anterior interventricular groove. Along it, left anterior descending artery will come down. This is left part of the atrioventricular groove. This is left margin of the heart. Okay, this is great cardiac vein, number 1. Great cardiac vein begins on the anterior surface of the heart near its apex. Yes, coming from here near its apex. It consists of 2 parts, the first part and the second part. This is the first part. The first part ascends parallel to the left anterior descending LAD artery along the anterior interventricular groove. So this one will ascend parallel to the LAD artery, reach up to the atrioventricular groove. When it's reached the atrioventricular groove, it turns right and become second part of the great cardiac vein. Second part of the great cardiac veins runs along the atrioventricular groove towards the left, following the circumflex artery. Along here will be circumflex artery, and when it's reached to the left border of the heart, great cardiac veins will curve backwards and reach to the back of the heart, where it joins with the coronary sinus. Next tributary of the coronary sinus is number 2, middle cardiac vein. Let's look at the heart. Here you will see at the back of the heart will be posterior interventricular groove, where the branch of the right coronary artery, right posterior descending artery, will be coming down here. Now we are going back to the middle cardiac vein. This is the middle cardiac vein at the back of the heart, running along the posterior interventricular groove, going up and join the coronary sinus and drain into it. The third tributary of the coronary sinus is the small cardiac vein. This is the one small cardiac vein, accompany the right marginal branch of the right coronary artery. Small cardiac vein will drain into the coronary sinus near its termination. Small cardiac vein will drain to the coronary sinus near its end, near its termination. Fourth tributaries of the coronary sinus is posterior vein of left ventricle. This is the one. It runs on the diaphragmatic surface of the left ventricle and drains into the middle part of the coronary sinus. The fifth tributaries is the oblique vein of left atrium, also called oblique vein of Marshall. This is the one. It runs downwards at the back of the left atrium and opens near the right end of the coronary sinus. It is coming down from the posterior surface of the left atrium and drained into the coronary sinus. This is oblique vein of left atrium of Marshall. Union of oblique vein of left atrium and the great cardiac vein is the beginning of the coronary sinus. So from where the coronary sinus begins is where oblique veins of the Marshall join with the great cardiac vein, and from here the coronary sinus started. So then it ends into the or drain into the right atrium here. In addition to the 5 tributaries of the coronary sinus, which drain the venous blood from the wall of the heart, 2 more sets of small veins are also drain the venous blood from the wall of the heart. Let's see this diagram. This is right atrium. This is right ventricle. The groove between the right atrium and right ventricle is anterior atrioventricular groove. Here you can see few veins are there. They are 6 sets of veins, that is anterior cardiac veins. They are about 3 to 4 in numbers. Begin on the anterior surface of the right ventricle. They begin on the anterior surface of the right ventricle and cross over and open into the right atrium. They cross over this groove and enter and drain into the right atrium. The 7th set of small veins are Vena, cordis, minima. You will not see these veins in the diagram because they are very minute veins, begin in the capillary beds of the myocardium and open directly into the nearest chambers of the heart, chiefly to the atrium. That means these vena, cordis, minima will drain into the nearest chamber of the heart. That means it may drain into the right atrium, left atrium, right ventricle, or left ventricle. All the above veins finally drain into the right atrium, except of course vena, cordis, minima, because they drain to the nearest chamber of the heart. As you know, left half of the heart, that is left atrium and left ventricle, received oxygenated blood from the pulmonary system. However, because vena, cordis, minima, which also drain directly into the left atrium and left ventricle, that is venous blood, that is deoxygenated blood. Therefore, left atrium and left ventricle, and including blood in the ascending aorta, are never 100% oxygenated. So do the coronary arteries. References. Thank you to all of them. The End, illustrated and presented by Dr. Hamid Abdul Rashid. free medical education. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.